Okay, I'm going to be discussing gambling. It's a non-substance abuse disorder, is recently classified by the DSM-5. How do you define addiction? Well, we know that there's a lot of controversy around that, and there are people with different schools of thought who have different definitions, but at its basic understanding, it's the dependence on a substance or an activity such as gambling. Until the publication of the DSM-5, gambling was considered an impulse control disorder. After growing research, however, it's understood that substance abuse disorder and behavioral addictions such as gambling share a lot of common features. The evolution of understanding resulted in the renaming of impulse control disorder to gambling disorder, which has helped destigmatize it. Gambling disorders are now reclassified as a non-substance related disorder. Continuing with the disease overview, gambling is an example of risky decision making, which makes it an interesting study in human choice and behavior, which is often irrational. Risk versus reward is applicable to many decisions made throughout life. In gambling disorders, behaviors can lead to financial ruin, relationship problems, marital problems, even illegal acts. Similar to substance use disorder, gambling disorder usually begins in adolescence and young adulthood. It also shares chronic features and relapsing patterns, with many people quitting on their own. Just like in substance use disorder, gambling disorder shares urges and cravings prior to the activity of using the substance or participating in the activity. These positive mood effects are decreased with repeated behaviors, resulting in a need to increase the substance in substance use disorder or the behavior in gambling. The similarity to the tolerance experienced in substance use disorder is also similar in gambling without the physical cravings or the physical side effects that may result and can be dangerous. Signs and symptoms of gambling disorder include a preoccupation, restlessness, irritability when not gambling, spending in increasing amounts when gambling more to make up for losses, lying, concealing, financial issues, and relationship problems. Just like in substance use disorder, research suggests that gambling impacts the brain like an addictive drug. Gambling affects the reward system of the brain, specifically dopamine. The increase of dopamine creates the feeling of being high. Treatment options for gambling disorder. One treatment option is called motivational interviewing. It's a direct intervention that allows individuals to analyze their problematic behavior, which they often themselves minimize, like, my gambling really isn't that big of a deal, etc. The behavior is then compared to the general population, say like somebody that just wants to place a bet at the racetrack versus the chronic gambler whose behavior has become a problem. So that juxtaposition is used to motivate and encourage a behavioral change. Motivational interviewing is client-centered, it's therapeutic, it's non-judgmental, and it's meant to help ambivalence about change that people often have when they're thinking of getting help for a problematic behavior or addiction. It also emphasizes empowering the individual, encouraging autonomy to make those changes, while also acknowledging that feeling of ambivalence and the challenges that accompany change. Another treatment option is cognitive behavioral therapy, otherwise known as CBT. It's proven to be very effective in gambling disorder. It teaches the individual to identify, question, and reframe cognitive distortions, which addresses poor decision making and problematic behaviors. It also does a good job of addressing cognitive distortions that accompany addictions like gambling disorder. Some of those distortions for a gambler can look like things that they might say would be certain ritual. Every time I wear my red tie, it brings me luck when I go to the racetrack and gamble. The hat that I wear brings me good luck. If I don't have the hat, I'm not going to win, and that's why I'm losing today. I'm more likely to win, say, at horse racing because I know this game. If I lose, if I go to the track and I lose $25,000, I'm therefore going to have to gamble more to make up for that loss. If I'm on a winning streak, for example, I did really well in a couple races, I'm going to keep gambling because I'm on a winning streak, but ultimately that winning streak will end and you're going to lose a lot of money. So CBT does a good job of addressing those behaviors and cognitive distortions. Another treatment option that I'm looking at is medication. Currently, there's no FDA-approved medication for gambling addiction. There are some studies which suggest medications can be used to treat non-substance abuse disorders, but as of now, there's nothing approved by the FDA. According to the Mayo Clinic, medications such as SSRIs, mood stabilizers that accompany behaviors such as gambling addiction can help treat stuff like bipolar, depression, and anxiety. Narcotic antagonists too, they're often used to treat substance use disorder. Some people think that could also be helpful, but again, it's not proven. Patient resources. So if I had a friend that came to me and said they were suffering from a gambling disorder, there are resources out there to help them with that addiction. One is Gamblers Anonymous. It's based on the 12-step model. It's not for everybody, but there are people that choose to go there. Just like AA, it is a 12-step program. It's intended to help addicted gamblers take responsibility for their behavior and do everything in their power to change it. In Lexington, Kentucky, for example, I addressed gambling and horse racing, which sadly is a common thing here for a lot of folks. Being surrounded by horse racing, gambling on and off the track is an issue here in Lexington. I looked up some meetings. There are meetings held on Tuesday at 6:30 p.m. at the First Presbyterian Church. They also hold meetings Thursday at 6:30 at Roaring Brook Recovering Center. These two meetings are open meetings, which means everyone is welcome to attend, including friends and family members affected by the gambler's addiction. Another resource available for somebody suffering from addiction, gambling addiction, is called SMART Recovery, which stands for Self-Management and Recovery Training. It's an abstinence-oriented self-reliance model. It's an alternative to the 12-step program, which again isn't for everybody. This model focuses a lot on CBT, which I spoke about earlier. It's a 4-point program that addresses the following. Through CBT, enhances and maintains motivation to quit, helps cope with urges around gambling, manage problems, and encourages lifestyle balances. They have an online support community with online meetings and also local meetings. There are 6 basic elements of a meeting: the welcome and introduction. It's confidential. They teach self-empowering tools, urges, identify, solve problems, preventing relapse. There's the check-in, which it's basically a report for a few minutes about what has been happening with the individuals recently around their addiction. There's also an agenda setting, which can address any pressing issues that individuals might have when they come to the meeting. There's the working time, which basically is a forum to listen and to understand. There's a section called Pass the Hat, where they collect donations. Ooh, it's getting cold out here. And then there's a checkout and closing. So that's my presentation on gambling. If somebody were to come to me and basically just needed a background about it, I talked about a lot of the similarities between a substance use disorder. Again, that's been kind of controversial, but more and more research is showing that there are a lot of similarities and they can be treated in similar ways too. That does remain a bit controversial, but there, as I discussed, there are definitely some patterns and similarities, especially with dopamine response and other models that focus on behavior and the psychological implications. So again, there's a lot of great resources available. Those are just a couple. People can also go to individual therapy. They can join the support groups. They can also look online. And thank you.